Thank you for responding to my bell. It's quite an exciting little job I've got. I hope you had a chance to catch up with people and do a bit of networking and collaborating over a cup of tea or coffee. So we're going to get into the rest of our program. And the first speaker, we've got our panel of speakers over here. So the format will be each speaker will come up and do their presentation, and then Merrin will be introducing the panel, and there'll be an open forum, an opportunity to ask some questions. So I'd like to invite Jenny Skinner from the Ministry of Health. Jenny's a policy analyst at the Ministry, and she's going to talk about suicide prevention in the media. Welcome, Jenny.
Thank you, Sarah. And I'd like to start by saying a big thank you to Sarah and Merrin and Spins for inviting us all here today and providing a really good opportunity and quite a unique opportunity to bring together a whole range of expertise. And I know there's a lot of expertise in the audience as well as on the panel from media perspectives, people who are health professionals, researchers, and people from community organisations. So around the world and here in New Zealand, as we've already heard, suicide is an important public health issue, and that's why we're all here. Here in New Zealand, around about 500 people every year die by suicide, and we all agree that that's too many people who feel like they have no choice left but to take their own lives. And I also want to acknowledge that that's a lot of friends and families left behind, and every one of them knows what kind of impact that has on their lives and the distress that causes and how much potential is lost. So we're all here because we want to reduce the number of people who are dying by suicide. So the theme of World Suicide Prevention Day, which was officially yesterday, is Think Globally, Plan Nationally and Act Locally. It was great to have Jane's presentation this morning on the global perspective and putting what we do here in New Zealand in an international context. I'm going to talk about the second part of the theme, which is Plan Nationally. So what I thought I'd talk about is just briefly talk about our national plans for suicide prevention, the strategy and the action plan. And in particular, I'd like to talk about Goal 5, which is the goal about promoting safe reporting and portrayal of suicidal behaviour. And I'll also talk about the Ministry of Health resource about media reporting. So in New Zealand, our national plans for suicide prevention are the New Zealand Suicide Prevention Strategy and its accompanying action plan. And together these two documents say what we need to do to prevent suicide. So they describe a whole range of different actions across different sectors that can make a contribution to suicide prevention. And the national plans help to make sure that all the various suicide prevention activities that are done are well planned and well coordinated. And it's the role of the Ministry of Health to lead this coordination. And all these documents are available on the resource table if you do want to have a look later on. So the strategy and the action plan have 7 goals. One of the goals, Goal 5, is to promote the safe reporting and portrayal of suicidal behaviour by the media. The media is just one of the goals, and safe reporting is just one part of a comprehensive approach to suicide prevention. We've already heard that suicide is complex and there are many different factors in a person's life that can lead them to suicide. And this means that there are many different points that we can intervene to prevent suicide. So there are examples across all of these goals about different policies and programs and services that are in place already. I'm just going to give a few examples just to kind of put the media work in context. So we have programs in schools which aim to promote mental health and improve young people's resilience. We've got the National Depression Initiative, which the Minister mentioned, which is, you might have seen the TV ads which feature John Kirwan talking about his experience of depression. And accompanying that, there's a website called The Lowdown, which provides information and support, particularly for young people, about depression. And this focus on depression is important because we know that mental illness, and particularly depression, is the biggest risk factor for suicide. We also have a training program about how people can intervene if they're concerned that someone might be suicidal. There's work going on to improve the care and follow-up of people who've already made a suicide attempt, and other work to support families, friends and communities who've lost people to suicide, because we know that those people can be more at risk of suicide themselves. And we've also got a new initiative in 5 DHBs, which is a suicide prevention coordinator to coordinate suicide prevention at a local level. So I'm not going to talk too much more about the strategy and the action plan because today's focus is the media, but I just wanted to make the point that promoting safe reporting and portrayal is part of a comprehensive approach to suicide prevention, and there's already a lot of other stuff going on. And I think it's also important to note that our suicide rates are actually going down, so it seems like this comprehensive approach is making a difference, although there's obviously still more that we need to do. So let's have a bit of a closer look at Goal 5 to promote safe reporting and portrayal of suicide by the media. And I want to emphasise the point that Jane made, that this goal is not about censorship. We're not saying don't report suicide. We're just saying that when the media are considering reporting suicide, that they need to do this in a way that's safe and responsible. So the rationale for this goal is the huge amount of evidence really that we've heard from Jane that some types of reporting can increase the risk of further suicides by people who are vulnerable, and that this can result in an overall increase in suicide rates. I think sometimes it can be hard to understand, and that media articles reported in a particular way can actually do harm and can actually be the thing that might influence someone to take their own lives if they're already in a vulnerable situation. So as well as the evidence, we hear from clinicians who work with suicidal people who have talked to us about how people who are feeling vulnerable or suicidal are searching their environment for cues, and the media is part of that environment. We've also heard from teachers who are involved in the aftermath of suicides in schools who are really concerned about increased risk for a group of young people who are friends of someone who died, and are working really hard to look after those people. And I think sometimes we've heard that the group of young people can feel quite overwhelmed by the sudden media attention being given to their school. Having said all of that, I think that that most media reporting in New Zealand is done responsibly and safely. There was a recent move by some media organisations to develop their own set of protocols about reporting, and this is a move that we really support. We also recognise the value of media freedom and the role of the media in providing information to the public. And I think that media sometimes have a difficult role in balancing the media freedom and the public safety. So all this is background to why we have a goal about promoting safe reporting and what the goal says. Oh, sorry, I'm going to skip back. So Goal 5 describes the key areas that we'd like to focus attention on and work with the media in the next few years to promote safe reporting. We would like to promote opportunities like this for exchange of information and ideas in collaboration with the media, as well as with other stakeholders like researchers. I think it's always useful to try and understand one another's perspectives and establish some areas of common ground. And I think that when we're talking about suicide prevention, there is quite a big area of common ground. Many countries internationally, as Jane's already talked about, have guidelines, and in New Zealand we have a resource called Suicide in the Media, which I'll talk a bit more about in a minute. And as I said, more recently there's been the development of the media-owned protocols. We recognise that it's important that guidelines or protocols or resources are developed with media involvement and that they're well implemented. And guidelines or protocols on their own aren't enough, but need to be backed up by education and support, such as supporting journalism training, providing information to assist the media to understand the kind of background and evidence and issues, and providing information to media spokespeople. Goal 5 also acknowledges that although we do tend to focus more on the news media, increasingly people go to the internet for their news and information, and that's an area that we need to keep in mind. And we also need to keep in mind that this goal does cover fictional portrayal of suicide as well as non-fiction. So I'm just going to talk a little bit more about the suicide in the media resource. It was published almost 10 years ago, so it is at a point where we're looking at updating it, and we'd be really keen to work with the media on doing this. But having said that, the key points in the resource are still in line with the other international guidelines that Jane talked about. So the resource gives a brief summary of the evidence, it gives some background information and facts about suicide, and it gives some guidance or suggestions for the kind of things that media might want to consider when reporting or portraying suicide. And again, I just want to emphasise that it does provide information and guidance. It doesn't tell the media that they should never report suicide. We recognise that there will be times when media will report suicide, and the aim of this resource is to assist the media to do that safely. So these are some of the considerations that are in the resource, and this is the kind of things that we mean by safe reporting. So it's the kind of things that Jane's already talked about: avoiding repetitive reporting, not glorifying suicide, and not presenting simplistic explanations for suicide, which we know is a complex issue. And being particularly careful about reporting suicides of celebrities who can be seen as role models. Other things like avoiding descriptions of the method of suicide, avoiding reporting that's dramatic or prominent, so being careful with headlines and photos, and providing information like helplines about where to get help. I'll just briefly mention the Coroners Act. This Act limits the publicity about details of individual suicides unless this is authorised by the coroner. So it doesn't stop the media reporting general information about suicide, such as statistics or news services or policy initiatives. And I think the Coroners Act was initially put in place to protect families as well as to ensure public safety, and again needs to be balanced against this issue of media freedom. So in summary, promoting safe reporting and portrayal of suicide is part of a whole comprehensive approach to suicide prevention. We recognise that the media already generally take a fairly responsible approach, but I think there's still more we can do. And so I would like to support and encourage ongoing discussion about this issue, and discussion in forums like this and with the media. Thank you.
Thank you.